10 early warning signs of a brain aneurysm most people miss. What if everything you've heard about brain aneurysms is only part of the story? Most people imagine them as sudden, unpredictable medical emergencies that happen without any warning. But in reality, brain aneurysms often develop quietly over months or even years, with little to no obvious symptoms. By the time they're discovered, it may be because of a sudden, severe headache or another medical emergency. The truth is, however, that the body can sometimes give subtle clues long before that happens. These signs are often mild, easy to dismiss, or mistaken for everyday health issues, which is why so many people overlook them. Before we continue, it's important to remember that this video is intended for educational purposes only. It should not be considered medical advice, nor is it a substitute for professional diagnosis or treatment. If you're experiencing symptoms or have concerns about your health, please speak with a qualified healthcare provider. A brain aneurysm occurs when a weakened area in the wall of a blood vessel in the brain begins to bulge outward, much like a small balloon. While many aneurysms never rupture, recognizing possible warning signs early can make a significant difference. In this video, we'll walk through 10 subtle signs that may be associated with brain aneurysms. One of them is especially easy to miss because it's commonly mistaken for a much more ordinary condition. There's a good chance you've heard of it before without realizing it could sometimes point to something more serious. Let's take a closer look at these often overlooked warning signs together. Number 1, unexplained and unusually severe headaches. Everyone gets a headache now and then. It can come from stress, lack of sleep, even a change in the weather. But some headaches are different from the rest, and noticing that difference can be critically important. The kind of headache that can be linked to a brain aneurysm usually starts suddenly, reaches an intensity the person has never felt before, and is sometimes described as the worst headache of my life. This kind of pain can feel different from a migraine or a tension headache. It may come with a sharp, explosive sensation. Margaret was a 67-year-old retired teacher who had experienced occasional migraines over the years. But one evening, while washing dishes in the kitchen, she felt a pain at the back of her head sharper than anything she'd ever felt before, as if something had burst inside. At first, she blamed it on fatigue and tried to rest, but instead of fading, the pain kept getting worse. A sudden and unusually severe headache like this, especially one that's clearly different from headaches the person has had before, can be a signal that shouldn't be ignored. Experts note that when this type of pain occurs, getting a prompt medical evaluation is important because catching symptoms early can sometimes make a tremendous difference. Of course, a headache on its own can come from many different causes, so there's no need to panic. But as you'll see as this video continues, some symptoms may seem meaningless on their own, yet when combined with others, they can paint a much more significant picture. Now let's move on to the next sign, one involving the eyes that most people attribute to a completely different cause. Number 2, vision changes and double vision. Our eyes can reveal a surprising amount about the health of our brain. When certain types of aneurysms form near the nerves that control the eyes, they can lead to vision-related symptoms. These can include blurry vision, double vision, a drooping eyelid, or a sudden increase in sensitivity to light. These symptoms often start so mildly that people interpret them as a natural part of aging, tired eyes, or simply a change in their eyeglass prescription. Harold was a 72-year-old retired accountant who had noticed that his left eyelid had been drooping slightly for a while. When his wife first noticed it, she said, "You're probably just tired," and neither of them thought much more about it. But over time, the drooping in his eyelid became more noticeable, and at one point, double vision set in as well. Changes like this, especially when they occur on just one side and worsen over time, may be symptoms that deserve careful evaluation. Eye doctors are sometimes the first to catch symptoms like these, because during an eye exam, they can detect subtle issues with nerve function. Vision changes can sound frightening, but remember, many of these symptoms can come from far more common and harmless causes. What matters is noticing the duration and severity of the changes and getting a professional evaluation when needed. Now, let's move to another symptom that most people would never associate with the brain. Number 3, numbness or weakness on one side of the face. Sudden tingling, numbness, or weakness in the face is most often associated with a stroke, and that association is accurate. But some brain aneurysms can cause similar symptoms too, especially when the aneurysm puts pressure on nearby nerves. This symptom usually appears on just one side of the face and can show up as a slight curve at the corner of the mouth, an uneven smile, or unclear difficulty when speaking. Dorothy was a 74-year-old retired nurse who loved spending time with her grandchildren. One morning, while brushing her teeth, she noticed in the mirror that the left side of her face looked slightly different, as if that side had gone a little numb. At first, she blamed it on the way she'd slept on her pillow, but the feeling didn't go away throughout the day. When symptoms like this appear, time is extremely valuable because a quick evaluation can help rule out many possible causes. That's why sudden and unexplained changes in the face, no matter how mild they may seem, are symptoms that deserve to be taken seriously. The fact that this symptom can be mistaken for a stroke is actually a good thing in a way, because in both cases, getting a fast medical evaluation can be life-saving. Now, let's look at a symptom that most people simply chalk up to getting older, but which may actually carry much more information than that. Number 4, stiffness or pain in the neck. Neck stiffness is usually blamed on sleeping in a bad position or muscle tension, and most of the time, that explanation is correct. But in some cases, especially when the stiffness comes on suddenly and is accompanied by a headache, it can mean something different. This kind of stiffness may be related to irritation around the membranes surrounding the brain, and it's sometimes considered an early warning sign linked to aneurysm-related conditions. Walter was a 69-year-old retired carpenter who had always led an active life. One day, while working in the garden, he suddenly felt a stiffness in his neck so severe that turning his head felt almost impossible. His wife suggested a warm compress and told him to wait it out for a few days, since they'd dealt with something similar before. But this time, the stiffness came along with a mild headache, and that combination can call for more attention than neck stiffness alone. Sudden, severe neck stiffness accompanied by a headache is a combination of symptoms that health professionals pay particularly close attention to. Most of the symptoms we've covered so far may not be alarming on their own, but one symptom we'll get to later in this video is actually one of the most commonly overlooked and surprising of all. For now, let's move on to another symptom that people often mistake for stress. Number 5, sudden and unexplained nausea or vomiting. Nausea and vomiting are such everyday symptoms that they're usually chalked up to an upset stomach, food poisoning, or a simple virus. But in some cases, especially when they show up together with a severe headache, this combination of symptoms can mean something different. Changes in pressure inside the brain, even though they have nothing to do with the stomach, can trigger a feeling of nausea, because the brain processes these kinds of signals in complex ways. Evelyn was a 71-year-old retired cook who loved making meals for her grandchildren. One afternoon, she suddenly felt nauseated and soon threw up. At first, she blamed it on something she'd eaten that morning. But this nausea was accompanied by a kind of pressure at the back of her head, unlike anything she had ever felt before. Family members tend to blame symptoms like this on an upset stomach, but when nausea appears suddenly alongside an unexplained headache, it can be a situation that deserves careful evaluation. By this point, you've probably noticed that many of these symptoms overlap with one another, and that's actually not a coincidence, because the brain can respond in similar ways to pressure changes occurring in different areas. Now let's move to a symptom that most people never think about, even though it's fairly common. Number 6, sudden sensitivity to light. It's normal to squint on a bright sunny day, but for some people, sensitivity to light can appear far more suddenly and intensely. In medical terms, this is called photophobia. It's sometimes associated with migraines, but in some cases, it can also be connected to irritation of the membranes surrounding the brain. Ruth was a 68-year-old retired librarian who always loved reading in bright, sunlit spaces. But one day, while sitting by the window as she always did, she noticed that the sunlight felt like it was practically piercing her eyes. Even after closing the curtains, the discomfort didn't go away, and she realized this feeling was more intense than anything she had experienced before. Her family brushed it off, saying, "Maybe your glasses prescription changed," but Ruth's instincts told her something was different. Sudden, intense sensitivity to light, especially when combined with a headache or neck stiffness, can form a combination of symptoms that deserves careful evaluation. Most people attribute this kind of sensitivity to simple eye strain, and that's usually a fair assessment. But looking at the signals our body sends us as a whole can be far more useful than focusing on individual symptoms one at a time. Now, let's look at a symptom related to speech and balance, one that's often blamed on aging. Number 7, difficulty speaking or loss of balance. As people get older, some experience balance issues, and that can be a completely normal part of aging. But a sudden onset of loss of balance, a feeling of dizziness or trouble finding the right words while speaking can point to something different. These symptoms can appear when an aneurysm is located near the areas of the brain that control balance and speech. George was a 75-year-old retired postal worker who loved chatting with his neighbors. One day, while talking with a neighbor, he suddenly found himself struggling to find his words, as if there was a disconnect between his thoughts and what came out of his mouth. At the same moment, he felt a bit dizzy and nearly lost his balance. His neighbor blamed it on tiredness, but George felt that this sensation was unlike anything he'd ever experienced. The areas of the brain responsible for speech, balance, and coordination are extremely sensitive to even the smallest changes in blood flow and oxygen. When an aneurysm presses on surrounding tissue, or when even a very small leak begins, it can cause these areas to temporarily lose their normal function. As a result, a person might mix up their words while forming a sentence, their speech might become slurred, or they might stumble unexpectedly while walking. Some people dismiss this as low blood pressure, hunger, or brief lightheadedness, and don't think much of it. But if the symptoms appear suddenly, have never happened before, or even if they resolve within a few minutes, they should still be taken seriously. This is especially true if other neurological symptoms occur alongside it, such as numbness on one side of the face, weakness in an arm or leg, a sudden severe headache, or changes in vision. In these cases, getting an emergency medical evaluation without delay is extremely important. Early intervention can play a critical role in preventing potentially serious complications. Sudden difficulty speaking combined with loss of balance, especially when they occur together, can be symptoms that call for a fast medical evaluation. These symptoms are sometimes mistaken for signs of a stroke, and that's actually a helpful similarity because in both cases, acting quickly can make a huge difference. Now, let's move to a symptom that most people would never even think of, but one that can actually be quite meaningful. This is one of those surprising signs we mentioned at the beginning of the video. Number 8, enlargement in just one pupil. Our pupils usually react to light equally, both growing larger or smaller together. But in some cases, one pupil can appear noticeably larger than the other, a condition known in medical terms as anisocoria. This symptom can be a sign of an aneurysm pressing on the optic nerve, and it usually appears alongside other symptoms, such as a drooping eyelid or vision changes. What makes this particular symptom so surprising is that it's extremely difficult for the person to notice in themselves. It's usually spotted by a family member in a photograph or during a doctor's exam. Bernice was a 73-year-old retired seamstress who noticed in a photo taken with her grandchild that her pupils appeared to be different sizes. At first, she assumed it was just the lighting in the photo, but a few days later, she noticed the same thing in a different picture. This difference pointed to a change she had never actually felt, but one that was genuinely there. This happens because certain brain aneurysms can press specifically on the third cranial nerve, the nerve responsible for controlling eye movement and pupil size. As this pressure builds, the affected eye may no longer respond to light as well as it used to, and the pupil can start to appear larger than the other one. In some people, this can be accompanied by double vision, blurry vision, or a slight drooping of the eyelid. Because these changes are often painless at first, people may not notice them even when looking in the mirror, or they might simply blame it on tiredness. But especially when a new, unexplained difference in pupil size appears, along with other symptoms like a sudden headache, vision disturbances, or pain around the eye, getting a prompt medical evaluation is important. Of course, not every case of anisocoria is caused by a brain aneurysm. In some people, it can be present from birth, or it can develop due to eye drops, medications, or various eye conditions. What matters most is taking newly appearing, unexplained changes seriously. Enlargement in just one pupil, especially when it occurs alongside other symptoms, can be an important signal that shouldn't be overlooked. What makes this symptom so sneaky is that it's almost impossible for a person to notice it in their everyday life. That's why the people close to us noticing small changes in our face can sometimes be even more valuable than our own observations. Now, let's move to a topic that most people think of as simple tiredness, but one that can actually carry much more meaning. Number 9, sudden and intense fatigue or mental confusion. Fatigue has become an almost unavoidable part of modern life, and most of the time it comes from not getting enough sleep or from stress. But in some cases, a sudden and unexplained feeling of exhaustion, especially when it's paired with mental fog, can mean something different. This kind of fatigue can be a sign that the brain's normal functioning has somehow been affected, and sometimes the person describes feeling like they don't feel like themselves. Thomas was a 70-year-old retired farmer who had never once complained of fatigue in his entire life. But one afternoon, he suddenly noticed that his usual energy had disappeared, and his thoughts had become foggy, as if he were looking at the world through a veil of mist. His family blamed it on his age and the change of seasons, but his wife noticed that this state was nothing like his usual tiredness. This happens because the brain needs a constant, steady blood supply to function properly. The pressure created by an aneurysm, or in rare cases, a very small leak, can cause certain areas of the brain to function differently than expected. As a result, the person doesn't just feel physically drained. They may struggle to make decisions, have trouble putting words together while speaking, or find it unexpectedly difficult to perform even very simple tasks. Loved ones often interpret this as they seem distracted today, they probably didn't get enough sleep, or they're just getting older. But if this change appears clearly within minutes or hours and represents a sharp departure from the person's usual state, especially when accompanied by other symptoms like headache, vision changes, nausea, or balance problems, this should not be considered ordinary fatigue. Fatigue on its own doesn't indicate an aneurysm, but when it appears suddenly alongside unexplained mental changes, it can be an important warning sign not to delay a medical evaluation for. Sudden, unexplained fatigue combined with mental confusion, especially if it's never happened before, can be a symptom that deserves careful evaluation. What makes this symptom so tricky is that fatigue is such a universal experience that people almost never take it seriously. But considering the context, meaning noticing when the fatigue started, how long it's lasted, and what other symptoms have accompanied it, can make a tremendous difference. Now we've arrived at the final symptom we promised at the start of this video, one that most people would never think of, and perhaps the most important one of all. Number 10, seizure-like sudden loss of consciousness or convulsions. This final symptom is the surprising sign we mentioned at the beginning of the video, the one most people attribute to a completely different cause. Having a seizure is usually associated with a chronic condition like epilepsy, and people rarely think it could have any connection to a brain aneurysm. But in some cases, especially in a person who has never had a seizure before, a sudden seizure can be the first sign of an abnormal change happening in the brain. This kind of seizure can show up as a brief loss of consciousness, uncontrolled convulsions, or a few seconds of just blanking out. Norman was a 66-year-old retired firefighter who had never experienced any neurological issues in his life. One evening, while sitting at the dinner table, his gaze suddenly went blank, and for a few seconds he didn't respond to anything around him. His family initially thought he was joking around, but when Norman came to, he didn't remember what had happened and complained of a mild headache. An event like this happening suddenly in someone who has never had a seizure before, especially when considered alongside other symptoms, can be a situation that calls for an emergency medical evaluation. What makes this particular symptom so unexpected is that most people associate seizures with entirely different medical conditions. Very few would think they could have anything to do with a weakened blood vessel in the brain. But our bodies don't always send clear, obvious warnings. Sometimes they communicate through subtle signs that seem unrelated at first, yet together they can paint a much bigger picture. One important thing to remember is that none of the 10 symptoms we've discussed can, by themselves, confirm that someone has a brain aneurysm. Many of these signs can have much more common and harmless explanations. But when several of them appear together or become persistent, they're worth paying attention to and discussing with a healthcare professional. Brain aneurysms are actually more common than many people realize. Studies suggest that around 2% of adults may have an unruptured brain aneurysm without ever knowing it. The encouraging news is that most of these aneurysms never rupture or lead to serious complications. Even so, recognizing possible warning signs and seeking medical advice when something doesn't feel right can make all the difference. Now we'd love to hear from you. Which of these 10 signs surprised you the most? Was there one you've experienced yourself or noticed in someone close to you? Share your thoughts in the comments below. Your experience could encourage someone else to pay attention to a symptom they might otherwise ignore. If you found this video helpful, consider sharing it with your family and friends so more people can learn about these often overlooked warning signs. And if you'd like to see more evidence-based health content like this, be sure to subscribe to the channel. Thanks for watching, take care of yourself, stay informed, and we'll see you in the next video.